So the fatal outcome of infectious diseases, if it is caused by a resistant type of bacteria, cannot be cured with a normal, let's say normal, so the everyday used antibiotics. We need some special ones which are not very well fit to that type of infection or bacteria. Just we don't have anything else. So it is very important to try to avoid the spread of these types of bacteria. So not only the treatment is important, but also there are some public health arrangements of it. So that's why it is just essential to find solutions for this problem.
Now there is a public awareness that people really have bacteria that are resistant to antibiotic treatment. There is social awareness and also an expectation that health systems should be doing something about it. And now we bring this solution, which is a rapid test. So when a patient enters a hospital, in 15 or 30 minutes there will be a prescribed medicine and antibiotics that will treat this resistant bacteria. This is why this workshop is super important. We are spreading the word about this new solution of fighting AMR, the antimicrobial resistance, here in the countries of the European Union.
Probably the key will be the reimbursement of this test and of course the cost of this test. That's why rapid tests like strip, I think they could have a good place on the hospitals, like we are already seeing for the COVID-19, because almost of the rapid test or home tests are based on the strip use. So I think for the AMR, the key priority will be the reimbursement of this test and the cost of this test. And of course the effectiveness.
A rapid diagnosis is crucial. And this is due to the fact that antimicrobial resistance is increasing, so bacteria are more and more resistant to antibiotics. So providing an empirical treatment, so that means if I am a clinician, I'm diagnosing an infection to you, and I said, I give you this antibiotic. Due to the fact that the bacteria are increasing the resistance, the probability to be wrong in the treatment, this empirical treatment, is increasing as well. So I need a rapid test. That means that I need to know as soon as possible what is the cause of the infection and what is the antibiotic that I can use to treat this infection.
Having rapid diagnostics is key against the fight for antibiotic resistance, because knowing earlier which antibiotics are useful or not useful will help clinicians spare the use of those antibiotics that will not be useful. If you spare those antibiotics, if you do not use them, those antibiotics will be useful longer. If not, the longer you use antibiotics, the more that you use them, the more resistance is going to be created. And the more resistance is created, the less useful those antibiotics will be. So in the end, having that information earlier allows doctors to use the best treatment for patients.
Antimicrobial resistance it's a key issue, because when these bacteria infect humans, then we will have problems by treating. So in order to prevent these infections to occur, we need to be able to identify patients that are either infected or carriers of these bacteria, because you can be a carrier in your digestive tract of this kind of bacteria, in order to prevent then transmission from one patient to another. And the only way that we can curb with the current pandemic is to use rapid diagnostics. Whenever you have the feeling that you are a contact of a COVID carrier, you do a testing. And for AMR, it's exactly the same. Whenever you have the feeling that a patient could be maybe infected or carrying a multi-drug resistant bacteria, we need to be able to detect him to see whether it's true or not. And to do this, we need very rapid diagnostic tools and very easy to perform tools. And AMR Detect tool is probably one of the fastest and one of the easiest to perform. There is no need of specialized technical skills. Everyone can basically do it. So this will probably help to identify carriers very rapidly in a hospital setting.